Welcome, ladies and gentlemen, to today's tutorial. Today we want to look at one of the bones of the face, being the mandible. Yes, just like the maxilla, it also bears teeth. As you can see, it also bears teeth. But in addition, yes, it is U-shaped, as you can see, or horseshoe shaped. It is the only bone of the skull which does not articulate with the other bones by way of sutures. It is just held, connected in place in the temporomandibular fossa or temporomandibular joint by way of ligament. Yes, this bone developmentally actually consisted of two bones which were joined together on the midline by what you call symphysis menti, which is cartilaginous structure. Is the bone actually presents with what you call a body which is horizontally placed. So this is the body of the mandible, and this body, if you look at the midline, yes, there is this prominence over here which is known as mental prominence. Now just lateral to the mental prominence is the mental tubercle. Now in the area of the mental prominence, internally we will have two tubercles. This is actually the genu. So these tubercles, we will have one being a superior tubercle and an inferior genial tubercle, together forming what we call the mental spine. Now if we look at the superior aspect of the body, you can see that it's having these margins or crests, known as alveolar crests, where the teeth, the root of the teeth will fit, and in between them will be interalveolar septa as well. Now if you go to the internal aspect or the posterior aspect, yes, of the body, what we find is that it is going to present with this line over here. This line is known as the mylohyoid line. So as you can see, we have this mylohyoid line. Now just superior to the mylohyoid line is this fossa for the sublingual gland. So this is the fossa for the sublingual gland, and below it will be the fossa for the submandibular gland. And this mylohyoid line is actually going to provide attachment to the mylohyoid muscle. Now moving away from this point, but actually at the external aspect too, we're having these foramina known as mental foramina, one on either side, mental foramina, which will allow for the transmission of the terminal part of the inferior alveolar nerve and vessels. Now if we look at it again, what happens is that moving away from the body to this portion, which is known as the ramus or the ring of the bone, is this transition point known as angle of the mandible. Now this is the ramus of the mandible, which bears two main processes, a posterior process and an anterior process. The posterior process, known as the condyloid or condylar process or condyle, is actually having a head. It's also having a neck. And this is the crown-shaped process which orients anteriorly, known as the coronoid process. Now this coronoid process, in between the coronoid process and the condylar process, will be the mandibular notch. Now the internal aspect of the ramus, we are having this foramen known as mandibular foramen. It's actually for the transmission of the inferior alveolar nerve and vessels. But in between But we have this, tongue-shaped process, which is known as the lingula. Okay, lingula, which guards actually the mandibular foramen. Moving away from the mandible is another U-shaped bone known as the hyoid bone. This hyoid bone is actually having a body and then having these horns. So it's having these greater horns known as greater cornua on either side, and it's also having these lesser cornua, and that's the body. It's also U-shaped, just like the mandible. Now, it has forensic merit, because if there's a death case and there's that suspicion of strangulation, then the integrity of this bone is very important. Will have to be assessed. If it fractured, then it means there's that possibility of strangulation. Otherwise not, because whenever this bone gets fractured, the tongue gets displaced from the oral cavity. Let me just finish with this. This is actually the nasal cavity. And you can see, yes, we saw the nasal spine. We saw the vomer, and then we said this is the perpendicular plate of the ethmoid bone, and we said these two bones, perpendicular plate of the ethmoid as well as the vomer, are going to form the bony component of the nasal septum. But in the living, there will be what you call septal cartilage contributing to the formation of this nasal septum. These are actually the nasal conchae. Yes, these are the inferior nasal conchae, which you said are separate bones, and these are the superior nasal conchae, which are part of the ethmoid. So, ladies and gentlemen, this is a quick tutorial on the hyoid bone as well as the mandible. Thank you.